morning, everyone. Today I would like to talk with you about antipsychotic medications. Andy, last week your psychiatrist prescribed you some medications. Have you been taking them?
Yes.
He has been taking them on and off. Today, I made sure he took them.
I know it can be hard to take medication every day, but we really want to help ensure that you succeed in this program. And for that to happen, medications should be taken every day at the same time to be most effective.
He can't even remember to brush his teeth in the morning.
Some medications can be taken in a form of injection once every couple of weeks. It is worth mentioning to your prescriber that you have problems remembering to take your medication, and you can ask if you could take injections instead. But we can all brainstorm some ideas that will help you remember to take them regularly.
He can set the alarm clock each day at the same time.
That's a great idea. Andy, how do you feel about your new medications? Did you experience any side effects?
Medications turned him into a zombie.
Don't say that.
Marissa, but this is true. Just look at him. This is not my grandson.
He constantly feels sleepy, and he never wants to do anything. He doesn't want to do my homework, and he got his first F on his English test.
I am just really worried. How is he going to get accepted to college if he is falling asleep constantly? Or if he decides that he doesn't want to go to college? How is he going to work?
Most medications have some sort of sedating effect. They can make you feel drowsy or even sleepy and prevent you from fully experiencing emotion the way you are used to. Some people feel a sense of restlessness, agitation, or dizziness. One of the most troubling side effects is weight gain.
So he will also gain weight? He was bullied for years for being fat. He just lost most of his weight 2 years ago.
He also is constantly hungry. I don't remember him eating that much since he turned 10.
My life is over.
There are different strategies we can use to help you manage your weight. We often refer clients to dietitians to help you create a healthy meal plan, and we work with the whole family on how to introduce new habits.
That would be helpful.
Andy, did you notice any positive changes after you started taking your medications?
He definitely sleeps better. His symptoms are slightly less frequent, and he doesn't hear as many voices as he did before.
You sleep all the time. Are there really any benefits of taking those medications?
Medications help to reduce voices, delusions, and difficulties thinking clearly during and after acute episodes. When combined with psychosocial treatment, 70 to 90% of people experience significant reduction in symptoms and minimize their chance of relapses and hospitalization.
I don't think Andy will continue to take the medication if the side effects don't go away.
So Andy, it looks like this medication makes you feel tired, it is harder for you to do schoolwork, and your appetite increases significantly. On the other hand, it helps you reduce your symptoms, you hear voices less frequently, and your sleep is better. Am I correct?
Yes.
Yes.
Everybody reacts differently to each medication and experiences different degrees of side effects. It is important to talk to your prescriber about your side effects so they can help you find the right medication for you. Sometimes you need to try a few to find the one that helps reduce your symptoms, but at the same time, its side effects are manageable.
Our psychiatrist is usually very busy. We don't want to take too much of his time.
I understand sometimes talking to a psychiatrist might be very intimidating, but it is important to be an active partner with the prescriber when making decisions about your medications. We can practice together to help you express your concerns during the next visit. How would you introduce the topic of side effects to the prescriber?
Recently, we noticed some side effects with Andy's medication. Could we take a moment to discuss them?
Great. Now it's Andy's turn to describe his side effects to the prescriber and what kind of help he needs.
I'm constantly sleepy, and it's difficult for me to stay awake and do my schoolwork. And
Do you have any suggestions on how he can be less tired during the day so he can complete his homework? It is important for him to get to his dream college next year.
Great teamwork. It is extremely important to let the prescriber know what goal Andy wants to accomplish. They might consider either changing the medication or adjusting the dosage to reduce its sedating effect.
If he feels better, will he be able to stop taking medications?
To reduce the risk of relapse, it is recommended that a person continues taking antipsychotic medication for a year and sometimes longer, even after symptoms are better. I think we have a great plan for next week. Tomorrow, on your visit, you will address your concerns about the side effects with the prescriber. You will set an alarm to make sure you take it every day, and in a week, we will discuss its benefits and side effects.
Thank you for your help. We are looking forward to talking to you next week.